You should never get tensed up for any such things. You should be cool. Then only if your mind is cool, then you'll be able to diagnose properly.
Yes, ma'am. Being cool and calm is the key for, I think,
Yes,
everything
yes.
in life. It is very rightly said that diagnosis is not the end, but rather the beginning of any practice. If a disease is rightly identified, obviously the resolution is more likely to come because of a correct treatment plan. Well, our episode of Tooth Talks is about a specialty which is at the forefront of diagnosis, which is a unique blend of technology, science, and patient-centric episode. Yes, you guessed it right. It is the Department of Oral Medicine and Radiology. On that note, hi, I'm Dr. Ichita Joshi, your host for this show. And in today's episode of Tooth Talks, Navigating Your Dental Journey, we are going to talk about the Department of Oral Medicine and Radiology. And for that, I would like to thank Cuspyd, whose support makes this show possible, because of which we are able to put out all this creative content for you all. Cuspyd is an evolving edutech company which is putting in efforts to transform the way in which dental professionals learn and grow. So today we have our special guest with us today, that is Dr. Pratyusha ma'am. Ma'am, welcome to the show. We are honored to have you here. Telling more about our special guest here, ma'am has done MDS in Oral Medicine and Radiology, and she's currently working as a consultant dentist and a cosmetic surgeon at KIMS Hospitals. Not just this, ma'am has been associated with KIMS Hospital since its inception. Ma'am specializes in dental lasers and oral cancers and trauma. She has also done her fellowship in lasers from the World Clinical Laser Institute, USA, and Masters in Cosmetic Dentistry. Her knowledge doesn't stop here. She's also an implantologist and an author of various research papers, and also a member of various national and international academies and associations. Without further ado, let's get into this interesting conversation about the Department of Oral Medicine and Radiology. So ma'am, starting with the session, I am really curious to know your journey as a dentist and as an OMR specialist.
There is a thin line of between as a dentist and OMR specialist, because when we are practicing as a dentist, we'll come to know some oral lesions. When we are going through the patient diagnosis, we'll come through the oral lesions if they have any habits. Well, see, diagnosis is the main step for anything. So I call it as mouth is a mirror image of all the systems.
Yes, ma'am.
When you open the mouth, even without even asking the patient what is your problem, like that, we can even identify. We ourselves will identify. Yes, he is a smoker. He is a bit nut chewer, or he has got these habits, or any systemic illnesses like many diabetes or arthritis. So many things we can identify through the mouth.
Yes, ma'am.
So that's a very interesting aspect of OMR when you are examining as a dentist.
Yes,
a normal practitioner. There is a thin line. Only OMR is nothing but we'll be treating those pre-systemic lesions or oral lesions by means of our if you in terms of like implants, leukoplakia, precancerous lesions that we can treat along with the normal routine dental treatments.
Okay, ma'am. Ma'am, I think a lot of people say that OMR is like a non-clinical branch, but as you have rightly said that it is actually a very specialized domain. So
it's a vast syllabus, vast subject in my view.
Yes, ma'am, definitely it is.
Oral medicine is related to general medicine.
Yes, ma'am.
Oral medicine is nothing lesser than the general medicine people, because we do interact with cardiologists, we do interact with nephrologists, we do interact with dermatologists, we do interact with gastroenterologists, because esophageal reflux, burns, everything like that reflex will give you pharyngitis and acidosis, and uremic patients, gout patients.
Yes, ma'am.
So we interact with all systemic doctors so that we can treat them. Along with them, we also treat our oral diseases.
Definitely, oral medicine forms a bridge between the medical side and the dental
Yes,
side.
it is a definite bridge between medicine and dentistry.
Yes, ma'am. And I would like to add that it also forms the backbone of dentistry,
Yes,
because without
definitely.
diagnosis, what
Yes,
is the
yes.
treatment?
Yes.
So, ma'am, as you've told us a lot about this branch, so if a person wants to pursue the Department of Oral Medicine and Radiology, so what can that student expect in 3 years of MDS? What all is taught in that?
In 3 years of oral medicine and radiology, first year itself, will be kept in OPDs.
Okay,
We'll
ma'am.
be able to see the patients, number of patients. If it is there is a thin line again, government dental college and private dental college.
Yes, ma'am.
In private dental colleges and comparatively government dental colleges, patients will be more.
Yes,
And
ma'am.
we see every systemic, every tumor, every cyst, what we read in textbook, will be able to come across in dental colleges.
Yes,
Whereas
ma'am.
in private dental colleges, now they are coming. When we are studying government dental college, we used to see a lot of cases whether it comes to fibrous dysplasia or tumors, dangerous cyst, whatever. We used to read in only the books, but
Yes,
we
ma'am.
used to rarely see in private dental colleges that time. Now
Okay.
they are equal. Government and private dental colleges are equally getting all the cases, tumors, cysts, oral mucous lesions, and many things.
Okay.
And in second year of during radiology department, if it is oral medicine, oral radiology has its own specific things. Oral radiology, you will be able to learn now, not only taking intraoral radiographs, we'll be taking lateral oblique radiographs, we'll be taking temporomandibular joint trans radiographs and bite wings, all these, and 100 MA machine may will take jug handle views,
Yes,
all
ma'am.
posterior, anterior, anterior, posterior views. All these, out of all that, we will be able to interpret the radiographs rather than anyone. We'll be able to give a beautiful interpretation between the lesions and normal radial normal dental infections and the lesion infections and cystic tumors. The
Yes, ma'am.
differentiation between all this we will be able to interpret
Yes,
in a
ma'am.
proper way. It's a department which takes you back again, basic applied anatomy, pathology, physiology, biochemistry, everything will be taught in the first year.
Yes, ma'am.
And then you'll be refreshed with BDS, which we taught in first year of BDS. Will be refreshed again and will be into loop line, will come into the proper format, from loop line to proper format, and will be able to conduct examination on the patient and will be able to write proper diagnosis, proper case sheet format.
Yes,
You
ma'am.
need to write a diagnosis. Oral medicine is nothing but from your case sheet itself, your diagnosis will come. If you don't ask from the chief complaint, history of present illness or chief complaint, then past medical history. Past medical history gives us a lot of important things. So what the patient is suffering, what medication they are taking. From that, will be able to, if they are on blood thinners, will be able to take our type of modality of treatment will be changing.
Yes, ma'am.
So with all that, first year that covers more of theoretical way and diagnostic part.
Okay, ma'am.
Yeah.
So it's a very comprehensive branch which will
Yes.
teach you from the base till the specialized
Yes,
thing.
yes.
Okay, ma'am. So on that note, have you checked out Cuspyd's Instagram page? Because they are doing some in-depth book recommendations about various subjects. So do follow them and also drop a comment about which all books you want them to do next. Ma'am, are there any therapeutic procedures which are taught, and what all procedures are performed on a daily basis in the branch?
Yeah, there are therapeutic procedures like if a patient comes with the betel nut chewing and inability to open the mouth, what we try to do like intralesional injections by means
Okay.
of a few combinations with hyaluronidase with decadron, combination with local anesthetic. We give intralesionally into the cheek, and we do some incisional biopsies, and we do FNACs, cystic lesions. We do all those procedures. They'll teach us, and during radiology, in the radiology department, we'll be taught we'll be doing xylographies any
Yes, ma'am.
submandibular ductal calculus or parotid gland ducts will be able to identify by doing xylographs. So they all will be taught in radiology department. As therapeutic procedures, we do all these interlesional injections, and we do more of systemically compromised patients.
Yes, ma'am.
We'll be giving topical applications. All these will be taught.
Yes, ma'am. I totally agree, because even in my department, which is prosthodontics, if a patient wants a denture or something,
Yes.
and then patient is having OSMF,
Yes.
so we send them to oral medicine
Yes,
department.
yes.
So they prescribe all the medications and all, and after that the patient is able to get the treatment, at least complete dentures the patient is able to
Yeah.
get. So related to that, so oral medicine and radiology collaborates with a lot of other dental specialities.
Yes.
So there are collaborations with oral surgeons and oncologists, pathologists.
Yes.
So, ma'am, how does OMR department interact with other people and other departments?
So if anything, if you come across while diagnosing a case, if you come across after taking a radiograph, if you find a cyst, if you find a tumor, if you find what do you call growth.
Yes, ma'am.
So we'll be referring them to the oral maxillofacial surgery department. If you go along with them, if you're interested, you'll be with them. You'll be able to see the procedure. If you're interested, you can do the procedure at your practice while you're practicing. If you're not interested, it will you'll be referring them to the other departments.
Yes, ma'am.
If there is a gum problem, gum diseases, periodontal diseases, we'll be referring them to periodontics, department of periodontics. Like any cancer patients, they come with they come for the fabrication of nose, fabrication of eye, fabrication of ear. We'll be sending them to the department of prosthodontics, like the endodental. So like that, if any cardiac surgery is going on, we have to do some oral prophylactic conditions,
Yes, ma'am.
reasons to control bacterial endocarditis. Like that, we come across systemically. And
yes, ma'am, absolutely. And OMR plays a very important role in bringing all the specialties together. I think dental and medical both.
yes.
So coming to that, ma'am, what are the various career options which are there after doing MDS and OMR?
Like any other department, they also can open up their dental practice. They can work in as an academicians. They work in any product, like any pharmaceutical companies in product launching and all. They
Yes,
can
ma'am.
work as grading officers. There are many things they can go for fellowships. If they want to do in radiology, there are many fellowships, doctorate programs. There are because radiology is an upcoming branch. There's so many things are coming. Softwares are involved in post-proso or endo. Many things.
Ma'am, the department is evolving rapidly with all the latest technologies.
Yes.
So what all technologies or recent advancements any student who's pursuing OMR should definitely familiarize themselves with?
Nowadays, CBCT is more
Yes, ma'am.
upgradation in oral medicine and radiology. There are latest medicine CBCT, Conbeam CTs, which will see this radiology, oral medicine radiology students not only for taking radiographs, they also can give interpretation and they can design the implants. They can give in nerve course where exactly
Yes,
while
ma'am.
doing cystic enucleations and all, and will be able to apply density. We see the density of the bone. We can give we can give an explanation like whether the patient is suitable for implant or not.
Yeah.
One must should have interest.
Yes, ma'am.
Yes.
See, I was reading about all your work and what all you've pursued in the field of dentistry. And this is one thing I really adore about you, ma'am, that you have a lot of interest and passion towards the field. So
Yes.
you've not limited yourself to just one thing, but you have familiarized yourself with
I
so many
enter into
aspects.
all 7 branches of dentistry.
Yes, ma'am. You're having the
do.
best of all of it.
In my vision, oral medicine radiology people are the best people to be as clinicians because
Okay.
they'll have wide range of things to learn and put it up in clinics to
Yes,
work is.
ma'am. Yes, ma'am. This is the kind of passion I'm talking about, and
Yes,
it is
yes.
definitely contagious.
And we have pioneers also.
Yes, ma'am. Lots of pioneers are there.
Yes.
So, any pioneers you would like to tell to our viewers?
Hyderabad, Usmania, Dr. Venkateshwar Reddy is senior-most.
Okay.
The basic first professor of Oral Medicine and Radiology. And in Tamil Nadu Government Dental College, we have Dr. N. Gnanasundaram. Now he is no more.
So, you have definitely emphasized a lot on what the branch is all about. It was a great experience to talk with you about all this. So, keeping the technical part aside, ma'am, I'm looking forward to ask you some fun questions. So, we would like to know more about your perspective apart from all the technical knowledge. So, ma'am, can you tell us about your favorite dental instrument which makes your job a bit easier?
Luxator.
Okay. So, ma'am, I think sometimes some diagnosis comes which is very complex and difficult to figure out. So, how do you keep yourself cool and calm in that process?
I think you need to take some time and evaluate what is the basic thing started at first. It all depends upon your case history and evaluation.
Yes, ma'am.
Then only you will come into there is no such rush to get into your tension, or you feel tensed about that kind of particular case. You can think in terms of their case sheet and your evaluation, how they landed up into that particular disease, and then we can treat them properly, or we can guide them to the appropriate department.
Yes, ma'am. So, a lot of patience is
Yes.
involved in the process.
Nothing is, you should never get tensed up for any such things. You should be cool. Then only if your mind is cool, then you'll be able to diagnose properly.
Yes, ma'am. Being cool and calm is the key for, I think,
Yes,
everything in
yes.
life.
Being an OMR student, the case sheet is must, and it should be a proper evaluation.
Yes, ma'am.
If you don't evaluate properly through the case sheet, you don't land up in proper diagnosis. Once you know the diagnosis, anybody can do the treatment.
Yes, ma'am.
Diagnosis is must and should.
Yes, ma'am. Diagnosis is an art.
Yes.
So, you people specialize in it.
100%.
Ma'am, can you tell us about most fascinating oral condition that you've come across or you've diagnosed?
Oral meiosis.
Okay.
Oral meiosis. Like when I'm doing my post graduation, a patient came with a pouch of right maxillary sinus, a pouch. He says it was like bubbling sensation. He is a poor guy.
Mm-hmm.
He came, and when we saw into that pouch, there was a few maggots.
Okay.
So that's then we came to know that patient he was sleeping on roadside footpaths. There he got some dental infection, and whenever he was sleeping in that area, that started necrotizing, and he landed up in oral meiosis.
Okay.
That was an unforgettable case for me during my post graduation.
I can imagine, ma'am. It's
Yes.
definitely a very fascinating case to see. So,
Yes.
even I have read about it in textbooks, but I've never seen it.
Yeah, and we literally took out few maggots, and they're so much. Then we referred to the oral maxillofacial department. They did curettage and everything. After that, after a month, patient was fine.
Okay.
Yeah.
So, ma'am, coming to the next segment of the fun question part, this is called this or that. So, I'll be giving you two options. You can just select one as a rapid fire sort of thing. So, exploring rare conditions or tackling common dental diseases.
Exploring rare conditions.
Yes, ma'am. You are more fascinated by that. Intraoral camera or panoramic radiograph?
Intraoral camera.
Okay.
Because for smalls, in few seconds we can identify instead of waiting for few minutes.
Yes, ma'am.
And less radiation.
That is more important.
Less radiation.
Ma'am, CBCT or digital X-rays?
CBCT.
more comprehensive way to view it.
Yes, definitely.
So, ma'am, which one do you like more, interpreting 2D images or 3D images?
3D images.
Okay. So, you are more up for the advanced and latest stuff.
Three-dimensional view will give you proper content for us to diagnose.
Yes, ma'am. So, this episode gave us such a beautiful perspective about the branch of oral medicine and radiology. And ma'am has definitely given us a wider perspective about what it is all about. So, we are really honored to have you here. And this was a very informative.
It's my pleasure.
This was a very informative episode for me and a great interaction. So, thank you so much for coming here, ma'am. So, we have a small token of gratitude for you.
Thank you.
So, by the way, have you checked out other episodes of TED Talks Navigating Your Dental Journey? If not, they'll be linked on the screen. And do drop a comment and do subscribe to the channel for more such informative and educational content.